everyone, I'm Easy Peasy Medic here. Today in my video, I'd like to explain to you guys about bleeding disorders or causes of bleeding. Bleeding disorder can be divided into three causes such as clotting factor disorders, platelet disorders, and vasculature disorders. I will break these three causes down one by one into three separate videos as bleeding disorder is such a huge topic, so stay tuned for the next two videos if you are into it and would like to learn more about this topic. Without further ado, let's move on to today's topic, clotting factor disorders. Examples of clotting factor disorders are hemophilia, von Willebrand disease, and vitamin K insufficiency. Hemophilia is the commonest severe inherited coagulation disorders that impairs the body's ability to coagulate the blood. Hemophilia itself is classified into hemophilia A and hemophilia B. In hemophilia A, there is fetal egg deficiency with a frequency of 30 to 100 in 1 million male births, while in hemophilia B, there is lack of fetal nine with a frequency of 1 in 30,000 male births. Two-thirds of newly diagnosed infants have a family history of hemophilia, whereas one-third is sporadic. They both have X-linked recessive inheritance and they have the same clinical features. Next, I'll be moving on to causes of hemophilia. As I have mentioned earlier on, this is a hereditary condition. Hemophilia A is due to lack of fetal egg and hemophilia B is due to lack of fetal nine. Moving on to clinical features of hemophilia, the disorder is graded as severe, moderate, or mild depending on the fetal egg to C level in hemophilia A or fetal nine to C level in hemophilia B. Severity of hemophilia A is such: bleeding in neonatal period is unusual. Almost 40% of cases in neonates are associated with intracranial hemorrhage, bleeding post-circumcision, or prolonged oozing from heel stick and venipuncture sites. Most children present towards the end of the first year of life when they start to crawl or walk, and sometimes fall over. Bleeding episodes are most frequent in joints and muscle, known as hemarthrosis, which can lead to crippling arthritis if not properly treated. Bleeding can also occur spontaneously or after trauma, operation, or dental procedures. More than that, bleeding can also occur in transfusion-related infections such as hepatitis B and C or HIV. The picture shown is the severe arthropathy from recurrent joint bleeds in hemophilia. The aim of modern management is to prevent this from occurring. Investigation of hemophilia includes normal prothrombin time and increased partial thromboplastin time. Next, I will talk about treatment of hemophilia. Recombinant fetal egg concentrate for hemophilia A or recombinant fetal nine concentrate for hemophilia B is given by prompt intravenous infusion as well as by closely monitoring of plasma levels whenever there is any bleeding. Desmopressin infusion may allow mild hemophilia A to be managed without the use of blood products. It is given by infusion and it stimulates endogenous release of fetal egg to C and von Willebrand factor. Adequate levels can be achieved to enable minor surgery and dental extraction to be undertaken. However, desmopressin infusion is ineffective in hemophilia B. Moreover, intramuscular injection of aspirin and non-steroidal anti-inflammatory drugs (NSAID) should be avoided in all patients with hemophilia. That is all for hemophilia, and I would like to move on to von Willebrand disease. It is defined as the most common hereditary coagulation disorder which involves a defect in von Willebrand factor. The function of it is to bind glycoprotein IB receptor on platelets to subendothelial collagens. Von Willebrand disease results from either a quantitative or qualitative deficiency of von Willebrand factor. This causes defective platelet plaque formation, and since von Willebrand factor is a carrier protein for fetal egg to C, patients with von Willebrand disease also are deficient in fetal egg to C. Causes of von Willebrand disease is due to hereditary condition. There are many different mutations in the von Willebrand fetal gene and many different types of von Willebrand disease such as type 1, type 2, type 3, and type nomadi. The most common subtype is type 1. About 60 to 80% is usually fairly mild and it's often not diagnosed until puberty or adulthood. Next, I'll be talking about clinical features of von Willebrand disease. These are bruising, excessive bleeding after surgery, mucosal bleeding such as epistaxis or nose bleeding, and menorrhagia. In contrast to hemophilia, spontaneous soft tissue bleeding such as large hematoma and hematorosis are uncommon. As I have said earlier on, von Willebrand disease is due to lack of von Willebrand factor and lack of carrier protein for fetal A to C, so it has decrease of both von Willebrand factor and fetal A to C. Other than that, it has increased activated partial thromboplastin time and bleeding time, as well as a normal prothrombin time. Treatment depends on the type and severity of the disorder. Type 1 von Willebrand disease can usually be treated with desmopressin infusion, which causes secretion of both fetal A and von Willebrand factor into plasma. More severe types of von Willebrand disease have to be treated with plasma-derived fetal A concentrate, as desmopressin infusion is ineffective and recombinant fetal A concentrate contains no von Willebrand factor. Vitamin K insufficiency is defined as avitaminosis occurs due to decreased production of vitamin K1 or vitamin K2 or both. This in turn results in decreased synthesis of factor 2, 7, 9, 10 and decreased synthesis of protein C and S. Causes of vitamin K insufficiency include drugs like warfarin, malnutrition, malabsorption, alcoholism, cystic fibrosis, chronic kidney disease, cholestatic disease, and the list goes on. Investigation of vitamin K insufficiency include increased prothrombin time and normal or increased partial thromboplastin time. Lastly, treatment of vitamin K insufficiency is mainly about dietary adjustment. We must educate the patient to take food highly content of vitamin K or even vitamin K supplement is useful for them. Thank you for watching and lending me your ears. Please like and share my videos as well as subscribe to my channel. I will see you in my next videos. Bye!